Name is Edafe Okporo, and I'm honored to be running for City Council in Council District 7. Tonight, it's not about me. I think it's about the idea of what kind of New York we want to have going forward. But I would like to share a little bit about my story to give you an insight why this particular program was very important to me in particular. When I came to America a few years ago as an asylum seeker, I was detained in Elizabeth, New Jersey. While I was at Elizabeth, New Jersey, somebody came to visit me. Her name is Lillian. And I was like, I don't have a family here. But Lillian said she came from Riverside Church with a group of volunteers, and she started writing me letters. A few years later, she wrote me a letter and she told me that she's a retired city worker and her healthcare is affected. And she's like, Edafe, I can't run for office, but it's really bad that our council person was not responsive to the issue she had. So I knew I was going to step up and run for office. And through this process, I've been meeting with folks and having a conversation. And the other day, when we met with Bobbie to discuss our platform for older adults, there are some stats which really were jarring to me as an individual, is that 1 in 5 older adults in New York lives in poverty. The population of older adults in New York is 21% of the population, larger than the city of Philadelphia, the 6th largest city in America. And we do have a city council who is ignoring the needs of older adults in New York City because the Department for the Aging receive a very little percent of our budget. And when it comes to healthcare, one of the reasons why I decided to run for city council, our leaders have started implementing policies resembling the harmful National Agenda Project 2025. They are moving 250,000 public service retirees onto a profit-driven, cost-cutting Medicare Advantage. There's a legislation in City Council right now called Intro 1096 that has stalled in the City Council for over a year. Legislation that will permanently protect the health care of our retirees. And our current council member, Shona Abreu, remains silent, leaving seniors in uncertainty. I am proud to have received the endorsement of NYC Organization of Public Service Retirees because of my commitment to protect traditional Medicare option for our retirees. When it comes to public safety, it's also a concern and a cornerstone for my campaign. Every New Yorker deserves to feel safe in their community, especially our seniors who fear walking down their own streets. My approach is clear that we must empower our police to swiftly handle violent crimes by relieving them of responsibilities better suited for mental health professionals and emergency medical teams. There's a data that gets stuck in my head is that 2/3 of involuntary commitments for people into mental health institution happens in their homes. So this is more than just policing. It's about smarter and more effective solutions of care, common sense legislations that will guarantee a better life for older adults in New York City. There's a bill that will protect providing meals every single day of the year. It's not controversial. People call it a socialist policy, but there are older adults that don't have meals in their homes. You have probably heard my opponents boast about securing funding for parks and city agency. But let's be clear, that funding isn't personal accomplishment. It comes from our taxpayers' dollars, our collective effort. That's why, as I'm running for city council, I'm thinking about the individuals that make up this city. I want to secure funding that will ensure equitable distribution, prioritizing housing for low-income neighborhood, ensuring that every new build we have in our district prioritize affordability, and strengthening seniors housing. We have a lot of programs that can help people live a better life in New York City, only if we have a council that would work to fight for these progressive policies that will ensure that seniors and older adults in New York City are being cared for. That's why I am in this race. And that's why this excites me a lot. I'm going to hand over to Bobbie, which is an extreme expert in this area, someone that have informed some of the policies that we are fighting for. And Bobbie, thank you so much for taking the time to join us tonight. After the presentation from Bobbie, we're going to have a panel between two leaders in our city that have been fighting for seniors and older adults in New York City. Bobbie, would you take it over from me, please?
Sure, thank you for having me. Oh, I just came up very big. Okay. Just quickly, my name is Bobbie Sackman, and for 28 years, I was the Director of Public Policy at an organization called Live On New York. You'll see I just posted a recent housing report they did. And I retired, and I'm what they call failed at retirement. Some of you here, I have a feeling, can relate to that. And what I'm going to talk about today is really something happening on the state level, but it impacts hundreds of thousands of residents of New York City. And I believe it's connected to the struggle that the city retirees have gone through, in the sense that older adults, by the way, I prefer the term older adults to seniors. You could all call us what you want to, but that's just my preference. And the term our seniors, nothing personal, but it sounds like to me our children. I don't know. But language is important. So at any rate, I believe it's all connected, because I think older adults, and in this case also people with disabilities, are just left out and often very invisible. And I think that's a big thing of what's going on now with the situation. So really quickly, and there's more information, obviously, if anybody wants it. There is this program, it's got a long name, Consumer Directed Personal Assistance Program. The acronym is CDPAP, CDPAP. Okay, I hope I haven't lost you already. And what this is, it's funded through Medicaid, and it's been around for decades, started by the disability community, because it allows somebody who has a disability, needs home care, this is home care, to self-direct their care. And it allows family members to be paid, or you could hire your own personal care aides, or maybe a friend. They have to be approved. It doesn't allow spouses, though, so I don't know why, but it doesn't. But it could be your mother, it could be your daughter, et cetera. This program has grown a lot in recent years, and some of that is because you stole my favorite statistic, that 1.8 million people over the age of 60 in New York City is bigger than the whole city of Philadelphia by 100,000 people, mind you. But that's okay. I'm glad you're using it. So that's why you do advocacy, right? So
I copied that exactly from you.
I know, but it's okay, because you always want to hear your message back. That's really important. So at any rate, so it's growing, this CDPAP program, because of the numbers of older adults and also people with disabilities, especially after COVID. And so really, so what's going on is that the governor decided, Governor Kathy Hochul, and I'm doing this really quickly, and if you have questions, last May, almost a year ago, towards the end of the state budget process, she shoved this through. The legislature, they resisted it, but she's got the power to do that. She said that she was going to sign a contract with one central fiscal intermediary, and I'm going to come back to what that means. One central private equity corporation for a $9 billion with a B dollar contract. It's sort of, in a way, like going to Medicare Advantage in a whole different realm. It's this whole central, the idea of a corporation, and how they don't deliver good service, do they? And they make profit. And so what the governor said was there are these businesses, some of them are for-profit, some of them are non-profit. Stay with me for 1 minute, it's a little technical. They're called fiscal intermediaries, FIs, fiscal intermediaries. They administer this program. So let's say you're a mom and you're taking care of a disabled child, or you're a daughter and you're taking care of your mother or father who may have Alzheimer's. What the fiscal intermediary does is they make sure that the personal aid, the care aid, gets paid. They make sure there's other paperwork and documentation for Medicaid. So they administer the program. And there are 600 of these across the state, which is a lot. Some of that is so they can be culturally sensitive to language and all that. Some of that is because some groups are making money and there are good actors and there are some bad actors, and we don't want the bad actors. But what Hochul is doing is she said, we're just going to get rid of all of them. She signed this $9 billion contract with a company who's, they always have these bland names, PPL, Public-Private Limited. They have been sued in Pennsylvania. They've lost contracts in Massachusetts and West Virginia and other states. So why New York would ever sign with them? There's obviously politics we don't have time to go into right now. And so there are 425,000 people in New York State, about 200,000 here in the city. No, I'm sorry. Let me start again. I got that wrong. There's 280,000 people across the state, about 200,000 here in New York City, that are consumers of the care. There are about 425,000 personal care aides, whether they're family members or, regular home care workers. And that's 705,000 people across the state. It's probably one of the biggest programs you've never heard of, unless you know somebody impacted by this, and you very well might. And so not only was she going to transfer this to the State Department of Health, but she said, oh, we could do this in 3 months. When they went to do this in Massachusetts, which is smaller, much smaller than us in the numbers, they had a year and a half. And PPL still lost their contract. They have less people than when they did it in Pennsylvania, and there was a class action lawsuit because people weren't getting wages, they were leaving their jobs, and services were lost. So 3 months. April 1st is the well, actually, technically, probably March 31st, but April 1st is the deadline. If the state, Hochul, doesn't extend the deadline to sign up all 700,000 people with this one entity, frankly, we don't know what's going to happen. What's going to happen, we think, is that thousands will lose home care, jobs will be lost, families will just fall apart. You know how tenuous it is to hold a family together like this. And people, mostly women, will leave their jobs. And but the governor seems okay with this. We have applied tremendous amount of pressure. There was a press conference even today in Albany by Senator Leroy Comrie, who's from Queens, leading the way. And so we don't know. There's no plan B. There's literally no plan B on this. So the governor keeps claiming the Department of Health, infamous for not sharing any data, comes up with numbers, we don't know how, that $500 million will be saved by the state. By the way, I just read something that now they're saying $1 billion. And that's half state, half federal. It's Medicaid. Any money saved will be lost job, lost wages, lost services of home care. And a report, as if this wasn't all bad enough, a report came out just yesterday from the Fiscal Policy Institute. They're a research group that they actually labor back, they're a really good group, that the healthcare insurance program this PPL corporation is offering doesn't even pay for doctor visits, hospital visits, and you might pay up to literally $6,000 or more in out-of-pocket costs. First of all, it's a very low income workforce anyway. So you're basically losing your health insurance. And there's a whole, they call this a skinny plan. I sort of heard that before, but I never quite knew what it meant. Technically, it means that they're filling the requirements of the ACA, but it's not a serious healthcare plan. So it's a mess, and people are terrified. When you call to sign up and register, you get put on hold. They don't have the proper translation of language for you. You don't get the paperwork. Everyone's saying it's like calling Verizon, really. And the staff is not trained. They don't know what they're doing. I'm not blaming the staff that's answering, but they don't have a clue half the time. And so it bureaucratically has been a total mess, total mess. So imagine that you're watching each day go by now. And this all started, the transition starting date, it's a rather infamous date now, was January 6th. 3 months to sign up 700,000 people, because it's not only the consumer that has to register, it's all their personal aides. They may have 1, 2, or 3 of them or more. And so I hope you're getting the picture now. This is plain cruel. And I think a lot of it has to do with ageism, which you're raising, and in this case also ableism, people with disability. And I think, I don't know that they care. We're not even hearing that there's any care, but this one really has a deadline. And so what I'm asking, and I don't know if I sent you, but we could certainly follow up, is a call to action, which is immediately calling Hochul in your state assembly and state senators. And the message is simple at this point. Delay the CDPAP transition beyond April 1st. That's it. Leave a message. Albany office, please call your reps, and Albany is preferred. And then, you know, there's a lot more stuff. There's also a letter that we could share that Senator Comrie in the Senate, and I don't know this man. He's from the Hudson Valley. Assemblyman Yukis has begun. It's the same letter that they've been circulating, and you could ask your reps to also sign on to that, because at least they become public. So some of them like to say, well, I stand up in conference, which is when the Democrats meet, and I say this is bad, but that's behind closed doors, and that's not good enough. We need them to be public on this. So I think I'm about ready to close, but I just want to add something that when we have this mayoral race coming up, the primary, like any day now in June. Medicaid is indeed a state issue. However, if there are 200,000 people just on this program, you can imagine that's not even a whole other kind of home care, which is what they call licensed home care, which will be thousands and thousands more. I imagine looking at who's here today, those of you I can see, you have hair like me. You probably have care stories. And if we had another hour, you could probably share your care stories. Either you've cared for somebody, or you know somebody, or you know a situation where you're waiting for the shoe to drop, and possibly have experienced having home care in your life. And you know how important this is. So, and I just want to, one more quick thing, because you mentioned immigration. I don't have exact numbers on this, and I'm being honest, but from what I can gather, about 3/4 of home care workers in New York City are immigrants. Not a surprise. They're women of color, and they're immigrant women. To work for a Medicaid-funded agency, you do have to be here, quote, legally. If you're not working for a Medicaid-funded agency, like privately, which a bunch of many middle-class or richer families pay privately, then you can hire anybody you want, and they may be undocumented. So we're in trouble. And we also know that immigrants are being impacted whether or not they're here legally, because they live in these what they call blended families of folks who are legal and undocumented and all that. And it also cuts off the pipeline for future home care workers. And New York State has the largest shortage of home care workers of any state in the United States. By the way, everything I say to you, data point, whatever, like what I just said about the shortage, there's backup documentation. So what I should have started with, and I'm going to finish with, is that the New York Caring Majority Coalition, which is also called Caring Majority Rising, is made up of older adults, people with disabilities, family caregivers, and home care workers. We welcome you to join us. If you go to, and maybe put it in the chat,
So
caringmajorityrising.org. You can
we
sign
we
up and get emails and stay
we
updated.
emailed everyone before the event began, the carry majority link. And at the end of the session, we're going to also email everyone the
Okay.
action
And
as
you,
well as the link.
okay, and that's great. Use the Caring Majority Rising link because that's a website that's more up to date than another one, the New York Caring Majority.
Um,
I can put it in, I'll put it in the chat afterwards.
Matt,
Matt has it. Actually, Matt has it.
Matt, can you
So,
help put it in the
yeah,
chat for Bobbie?
that's it. So the call to action, Hochul and your legislators to delay beyond April 1st and sign on to Senator Comrie and Assembly Member Ekis. I'll try to put a link. I don't know if I can do that, but I'll get Matt to do it
Bobbie,
in
you're not leaving yet.
sorry?
You're not leaving us yet. You're still on
No, I'm
this.
not going anywhere. I'm just talking very quickly so I can get
Oh,
it done. Thank you. That's
no.
it.
You're
I'm
still on
done.
this panel.
Ah,
Uh,
Matt just put it in the chat. Thank you so much.
so, I am just having a grasp of like the issue. I know for many people, they might be asking, this is a question people ask, like, what is the impact of lack of home healthcare aid for seniors? Can you share a little bit on like, if this program does not exist, how does it affect like older adults in New York City?
So this is what we would imagine. This is why this program exists. People will go into nursing homes. Raise your hand if you want to go to a nursing home. I've never seen anybody raise their hand. They will go to the ER in hospitals. These are frail older adults. And simply they will die. Um, they say the best long-term care insurance is having a daughter and a daughter-in-law. Whoopie-doo, that's not exactly good public policy, but we all know that's true. And women leave their jobs or they work part-time or get stuck in some kind of job where they can do caregiving. And they lose hundreds of thousands of dollars of pension and salary and social security
So,
benefit over their lifetime.
so
This
it
is what will
affects,
happen. And I think a lot of them, but let me just say, a lot of what underpins this, whether it's conscious or not, is families should not get paid to do this. This should just be your family just takes care of you, and we still live in the 1800s.
So you don't need to have a gray hair for this issue to affect you. Like me and my spouse, I know that we have aging family members, and if there is no program that enable us to care for them, we have to care for them too. So if you have hair like me, this issue also affects you as well because care is a burden of the entire family.
And by the way, just because this program exists, I mean, thousands and thousands are family members getting paid, but they are family. But it doesn't mean that somebody walks away from that person. They're just getting support to do the job. I don't want to give the picture like, there's always this thing, oh, families are just, don't care about their older relatives or parents. And that couldn't be further from the truth. People are
Okay.
generally very committed to that care.
I also want to encourage all of you that you are on the chat. If you have questions for Bobbie, we still have opportunity to answer some of the questions that we can. If it's directed at this particular issue or any other older adult issue, please feel free to put it in the chat. And if you want to share one or two sentences of care story that I, as a candidate, can take with me when I engage with voters, please also feel free to share with us because this has helped me a lot to understand the issues that older adults are facing. Marianne, can you come on the Zoom? Because I remember when I was invited by you to the protest in front of DC 37, I met an older adult on wheelchair. She's like 80 something years old. And she came with her daughter. And they were both telling me that the burden of the healthcare lies on the daughter, who have to be calling the insurance for pre-approval. And because this is like she's carrying the burden of her mom too. So both of them were there. Can you share a little bit to us? Like, we know that this bill, Intro 1096, is going to codify healthcare for retired city workers. But why is this important at this moment?
So 1096 preserves a floor that's been in place for 60 years. Medicare was approved in 1965 by the federal government. It was signed by Lyndon Johnson, and it gave people equal access to health care. No matter what your skin color was or your income was, you could see any doctor or hospital in America. There are no networks. There was very rare prior authorizations, and if a medical institution wanted to be reimbursed by the federal government for under Centers for Medicare and Medicaid, for seeing you as a patient than they had to do with the segregation that was in place at the time. Because prior to this, if you recall this time, you had colored waiting rooms and white waiting rooms, and there was levels of care that was just unreasonable, which is one of the reasons why we're fighting not being forced into managed care as retirees, because that's what made this bill happen. In 2021, the mayor went to force all retirees that were Medicare eligible into managed care, Medicare Advantage. And if you didn't take that plan, they were going to give this plan to you for free. If you chose not to take it, you would have to pay $200 a month per person. So if you're a couple, it's $400 a month. If you're a couple with a disabled adult child, that's $600 a month. You may not be able to afford to have that. So that means our lower income retirees, which there's many of us, would be in that lower standard of healthcare simply because we didn't have money. Now, DC 37 retirees are mostly women, mostly people of color and lower income. Why would we be doing this to people and we're union? Was the craziest thing. It was literally, people talk about the crazy guy down in Washington, D.C. as bringing us back into the 1950s. Well, this would have done the same thing. So we said, no. We filed litigation. We've been suing the city for the last several years. We started that first case in August of 21. When we realized that this was going to be a process, and then the mayor kept going around every time a judge gave us a favorable decision, the mayor would go around that court order to do something even dirtier to us. So what we said was, no, we have to preserve this. We have to put this in legislation because we're retired. Many, 2/3 of us are retired. We were formerly in a union. When you're retired, you're no longer in a union. And many of us also, 1/3 of our retirees are managerial. They were never in a union. Those would be your policymakers, like your council members, your mayors, your deputy mayors, your commissioners, your lawyers. Not everyone in the city of New York is allowed to be in a union, but yet the unions were making these decisions with the mayor's office of labor relations. Now, everyone in the city of New York, for the last almost 60 years, you were given a choice of plans. And the theory was one of economics. If you had choice, you had competition. Those insurance companies would make services better, which would drive down costs. But to eliminate all those choices of plans and force everyone into one plan, and it's privatizing Medicare. It is a for-profit company. This made no sense coming from a labor standpoint, especially because Medicare Advantage plans have networks. Not every doctor accepts them. Not every hospital accepts them. And they're fraught with prior authorization that was literally in the hands of the city of New York and our former unions. And by doing that, if they ever wanted to pull more value out of the plan to put towards their collective bargaining or towards their raise like they had been doing, we were going to be the ones to suffer because they were going to add those prior authorizations back and burden us, creating more obstacles to older and disabled people from accessing their health care. So we decided to do legislation. The first bill was Intro 1099, and actually the first bill looked like 1096, but they kept telling us it's illegal, it violates collective bargaining. I'm like, how could it do that? We're not in the union. The Taylor law, collective bargaining laws don't apply to us. And they kept saying, no. And so we said they wouldn't even let it be introduced. So they said, strip it down to the bare minimum. So we took all the words out and we literally left two sentences. One sentence in 1099, that the second bill draft that we did said the city has to provide a Medicare supplemental plan. And the second line said nothing in this bill impairs any union from collective bargaining. And they still said the bill was illegal. It doesn't make any sense. So that bill was introduced in 23, I think, 23. It
23.
died in
Yes.
24, and we brought the new version back in 24, which came back to life this year, 1096. And we said, the heck with this. We're going back to the full version because they're all playing a game. Like, we know now they're playing with us.
You know,
Uh,
the councilman that introduced 1096, today, the labor union released endorsement and it wasn't endorsed. So this is not an issue for the benefit of the retirees. It's
Right.
to the benefit of labor. So what is wrong with traditional Medicare that the laborers want Medicare Advantage? Why are they forcing people into this option? Because I was speaking with somebody on Monday who said that a friend spoke to her about Medicare Advantage. And the line they use is that if you are pretty healthy and 67 years old, Medicare Advantage is okay. But immediately an healthcare scare happens, it becomes a
Right.
disaster. Can you share a little bit as regard to the experiences of retired city workers that have been forced into this healthcare and why this became a fight to protect traditional Medicare? Why is this a fight at all for older adults? Why are they not given the option to have the traditional Medicare that they want?
Because the insurance companies are for profit. They wanted the entire book of business from the city of New York, and they offered this plan to the city for free. And they figured that they can control it, they being the insurance company, because they can delay and deny you care or make you pay for care. Or if you can't pay for care, you're not using the plan, so they're not paying for health care. Thus, they're making money for their shareholders who hold their stock. This is why the insurance companies want it. Why? Because Medicare Advantage plans get paid a capitated rate. What's that? That means that the federal government says to like Aetna, we're going to give you $1,500 a month to give Medicare to Marianne so we don't have to do it. Now that's $1,500 a month, whether I go to the doctor or not. And if I don't go to the doctor for a month, that's ka-chinga. That's money in Aetna's pocket, $1,500 for Marianne. Now, if I'm healthy, they really like that because Medicare keeps paying Aetna $1,500 a month after month, while Marianne's out playing tennis and running a marathon and using silver sneakers and all this other stuff. But then about 5 to 6 years later, Marianne starts having problems and she needs to go to the doctor. And that's where the issues start. And typically, according to the Department of Human Services, the Office of the Inspector General, they find that seniors are typically on Medicare Advantage plans for about 5 to 7 years before they start having trouble. And now figure that you're 65, so 5 years, it pushes you up a 70, 72, and you're going to start having healthcare issues at about that time. And now you're going to start seeing those narrow networks and delays and denials of healthcare access. And by that point, you're a little older. You might have some cognitive impairments. You might be by yourself or need a child, an adult daughter or something to help you, like you're mentioning your friends. And this is why they want to do that, because it is a for-profit, privatized version of Medicare.
So, Bobbie, I want to rope you into this conversation because I think that at the state level, sometimes when we fight at the city level, the conversation is expanded to the state level as well. Do you see any similarities to these fights, or what could you tell us as regard to the fights that you're having at the state level in terms of like protecting older adults
Sure.
and the political rigmarole that affects access to care for older adults at the state level?
First of all, it's nice to meet you, Marianne. Hi. It's all part of the same battle. So
Yeah.
I always ask two survey questions. Who wants to go in a nursing home? We saw that one. Who trusts their insurance company? It's about equal to who wants to go into a nursing home. So On the state level, I just described what's going on with the CDPAP program, how it's going to one private equity plan. But on the state level for home care, it's called managed long-term care. And it's the same. It's the Aetnas and all the others. We have, again, we're very good with data, and we have reports that show that upwards of 3 billion with a B dollars a year are made in profit by these managed long-term care plans. Money that could go for wages, which is one of the reasons we have so few home care workers, could go for wages and go for more care hours that you actually get the home care you need. And they're pocketing it. We've been working on that issue as well. So it parallels. It's like this is the piece of the healthcare system that I'm focused on. You're focused on another piece, but it's all part of the same. And I want to emphasize that home care really is healthcare. You know, it's very
It
important to
is.
help somebody obviously dress and eat and go to the bathroom. I mean, that's your life. But there's sometimes medical and health skills, getting people in and out of bed. And I learned this from people with disabilities. I listened to them. They have breathing, you know, to help them breathe. And if it disconnects, and somebody told the stories, you couldn't reach it behind her. I mean, it's very serious stuff. And so it's part of the healthcare system. So it's all the same, but it's all the same. We're allowing billions of dollars to be sucked out of the system. And now adding insult to injury is the governor is purposely moving in that direction in this case that I'm talking about with this one central, you know, failed corporation.
And
So
where
yes, we're
ours
on the same track.
intersect,
We're on the
we
same
have
track.
people that are dual eligible, Medicare,
Right,
Medicaid, and they're
right.
also, that's I think what you're also saying is they want to privatize that too. Those dual eligible special needs people, they're being forced into privatized Medicare, Medicaid dual eligible programs. I just had a phone call again today with one of those from a woman from New Jersey that heard me on my WBAI radio show in Brooklyn on Fridays. And she found my phone number, and I don't know how she found my phone number, but she called me, and that is a mess. And the home care, I will attest with you, Bobbie. I took care of my mom through her end of life with dementia. My mom was in her 60s when she developed a frontal temporal lobe dementia. And even though I was FDNY EMS, when you're becoming a full-time caregiver for someone, it is a full-time job and then some. And home care, that's like a whole nother episode, Edafe, that we have to do, because what we went through with home care people and how the hours, the agencies, the pay, it's absolutely, that's just a whole nother mess.
You
But
know, yeah,
My
and thank you for sharing your story, by the way, because
thank
those
you.
are the stories. And Edafe was saying, I told him, get the care stories.
Esther,
It's a
my
really good way to open up a conversation with
my
people.
my
That would
friend,
be a whole
Yeah.
episode on itself, Bobbie.
my friend, I don't know if I can disclose her name because she's currently going through the process. And this week is the first week the husband is in hospice. She's a leader at Three Park, the local Democratic club on the Upper West Side. And she's 83 years old. And she said, I and my spouse have been together for 60 years. But now I have to care for him. And I am also old too. And that is making her afraid if
Yeah.
she can care for the spouse. And to apply for the Medicaid, I didn't know this. You needed a lawyer, and you paid the lawyer almost $8,000 to ensure that the application goes through. I don't want to mention her name because she
Well,
didn't.
not everybody does that, but yeah. But
So this is something that she
some
was telling
folks
me.
go to these elder law attorneys, and there's nothing wrong with that. I want to say that from the outset, and they're very expensive. And it helps them figure out the Medicaid system, because if you earn more than the Medicaid level, and if you're, for example, a retired city worker, there's a good chance you do. You may not earn much more, but it's enough to kick you up, you know, above. But there are ways, as they call it, to spend down, and often for that you do need an attorney. There is a nonprofit law group. I'm not sure if they help you with that, but they could probably send you in the right direction. It's called the New York Legal Assistance Group,
Yeah.
known as NILAG, nilag.org. But yes, it's definitely an expensive road to go down.
So I'm going to ask this question because two of you are working on two issues that affect majority of older adults, which are the largest voting bloc in New York City and the country as a whole. People feel frustrated that they elect leaders who end up not protecting the things they care about. So what can people do right now at the end of this section to make a difference for the lives of older adults, both at the state level and at the city level, and looking into further strengthening legislation for older adults in New York City? Any one of you could go first.
I'll start, okay.
Okay, go ahead.
That's okay, I don't know. It's all right. Well, I have, what I described has a deadline April 1st. So I have to admit that right now, that's what's on my mind. And the fact that we're even here is obviously appalling. I think that, look, I was a director of public policy. I worked on 28 city budgets, which is why I retired. I thought I'd kill myself if I had to do one more. And so I am familiar with that process. And aging always gets left out. The Department for the Aging has no entitlement money. It's all what they call discretionary, federal, state, and city, which means you have to fight for the same money over and over and over again. And the only thing I could think of is that older adults really have to be in contact with their representatives. The group, I'll put a plug in that I used to work with, liveonnewyork.org. They do advocacy. They bring hundreds of older adults to City Hall. They did something, actually, an advocacy day in Queens today. I think they go to each of the boroughs. And they fight for the city budget. They also fight for the state budget, but in this case, they fight for the city budget, and they're very grassroots. They represent the nonprofit organizations that run the older adult centers and Meals on Wheels and housing, on and on. So I think, but I have a feeling the folks on this call are probably already involved. But I think it's to just really call out ageism, and you're right. And I'll finish with this. According to AARP, the majority of people who vote are women over 50. And men, of course, over 50 too, but I guess that's how it is. And so why you wouldn't go after this vote, even for political reasons, has always just flawed me. But I think a lot of older adults don't pay close enough attention to who and what they're voting for.
I think you're right on that, because one of the things I've noticed, especially in this Democratic primary for mayor, is no one is really, we as a voting bloc, the older population is being ignored. Hands down. They see us coming, and Edafe could tell you, because he's been to many of our events, they don't want to talk to us. We've had radical elders at our group. They don't, AARP supported us. They don't want to hear the message. And where the younger candidates and the younger city council members will speak to issues that will affect your 30 to 45 group, they don't know what our lives look like, and they don't know the struggles that we have from any part of our life, from the minute we wake up to we have to go out, to we have to go to the doctor, to go to the grocery store, to get into the subway, to get on a bus, to go back home. And accessing services, or even trying to call an agency, the stress that adds on everyone, because there's city agents that don't answer the phone, or you could be on hold for 45 minutes. That's not the way things used to be. And that's not, you are going to get someone to hang up, and they're not going to call back because they're not going to get an answer. And then they're not going to do whatever it is that they're supposed to do because they didn't get the help to be able to do it. I find that very disturbing. We were told by another council member in Lower Manhattan this week, one of my retirees went into his office and was told, we were told we don't have to speak to any of you seniors. I was very disturbed by that. This retiree was very upset, and she said, look, I'm not getting calls back. I'm walking into the office. I'm not getting answers. I need help. And I said, well, it's the answer. The answer is that they don't want to address this bill that would protect Medicare. They don't want to answer her why he's not getting on the bill. And it's very frustrating. So literally to the point where his office called 911 and had 6 police officers come to his office, and literally the officers told the office, I think it's just best that you schedule an appointment with her, and the staff still refused.
Is any
So
of
now
that videoed? by the way?
No, I wish that was.
Just curious. I was just curious.
I'll talk to you offline. But I went crazy and did a crazy video. I did a very angry video on live stream that when that happened because she was so emotional and I was so angry that that happened to her. And that shouldn't happen. And yet then he puts out an email to his constituency blaming her. Course. So it's a population that I just honestly I feel that it's more ageist and they don't want to deal with our issues. I don't think they know how. I don't think they want to get involved. And they don't want to know the history. None of them want to know the history of Medicare. They don't understand the differences. They don't want to learn. And I don't think they really want to help. And I don't understand that because, as you said, this is the largest voting bloc in the city of New York. And that can make or break any election.
It's a shame. I'm going to open the floor. If you have a question, please ask our two guests why they are here. I'm going to be talking. If you have a question, please raise up your hand or unmute yourself and ask a question. You know, on the Upper West Side, where I lived the first few years of my life when I just came to America, there's this perception of like, in almost the entire city, there's a perception of like, who is most attended to? So there was a forum I did and somebody said, why do you care so much about older adult issue? These are the most entitled people ever. And I was shocked that somebody said that to me, because I've also heard that as an immigrant, that people tell me, you guys are the most entitled people possible. You come here, you get all the benefits, and all you do is suck from America. And I'm like, immigrants are some of the hardest working people in America, and the older adults have worked their entire life. So you expect them in retirement to still continue giving as much as like a 25 years old. That's why we title this section Retirement with Dignity, because most people in New York are getting to retire in a city that they love and work and contributed in. This is some of the pushback I have received as a candidate who is supporting older adult issues. I just want to hear from you guys. What are some of the pushback you have received?
You know, it's interesting because somebody recently said to me that they were talking to, I don't even know, but they said, oh, we don't care about older adults because they're just all white people that have whatever, they're middle class, whatever. And not only is this an appalling statement, period, but you said it earlier, almost 20% of people over the age of 60 live in poverty in this city. And over 50% of people of color and immigrants, and that doesn't mean you're living in poverty, but you know, many are. And I think there's this total willful ignorance of the situation of how people are really struggling in this city. You know, if you go to you know, like an emergency, like a food pantry or soup kitchen, or like a food pantry, right? Watch who's standing online.
Older adults.
It's the older women who are probably getting the food for their families. And there are, I don't remember the number, but it's over 100,000. There's thousands of grandparents raising their grandchildren in this city. They call it kinship care. You know, it just goes, so the intergenerational relationship with, if you do have grandchildren, obviously not everybody does, you know, is very strong. And so this perception is just, it's very, you can call it ageist, but it's also, you know, if you think of who's, you know, who's older than 60, as I said, it's also racist, you know? I mean, so for a younger progressive, and you're not looking at these policies that impact people of color a lot, then I just think you're blind. You're willfully blind to it. And anyway, that's a problem.
You know, I used to run a food pantry at St. Mary's Church on 126th Street between Amsterdam and Broadway. It's by Manhattanville, the NYSHA campus there. I ran it for 5 years. I can say, beating my chest, that the food pantry line on Monday is 99.9% older women of color, Latinx background, and Black majority.
I hope you talk about that, and maybe you do already when you go around, because I don't think that's the image.
Yeah, I do a food distribution on Saturday for homeless people on the street in Harlem. We do it from West Harlem to East Harlem. If you look at the people on the street, they are older men within the ages of 55 and above, people of color. So the wealth disparity among seniors who do not have a retirement savings or pension and have to depend on government support is overwhelmingly Black and people of color. So that baffled me when I heard that. Do we have any question? If we don't have any question, I will.
There is, somebody has her hand up.
Oh, Antonia.
Yes. Good evening, everyone. And I call you all warriors. And this whole fight started. I am one of the foot soldiers, you know, in Marianne's organization and an alliance. A whistleblower. That's how this started. They were going to push us into that Medicare Advantage because of the whistleblower that told all of the responsible local presidents, we're not going to have this. That started us hitting the streets, as old as we are, hitting the streets, hitting the courts. Hey, an injunction. Hold on. Nothing's going to happen because this is illegal until we settle this in court. 5 years later, we're still fighting, but that's all right because we are still fighting and the courts cannot do anything as long as we have those fights going on. As long as we have people my age with my color hair and different colors hairs and different colors fighting. Okay, this is what this is about. Bobbie, Marianne, Edafe, this is what this is about. The fight. When they see a lot of people fighting, when they see their courtrooms filled, when these insurance companies see a lot of people outside, when my own damn union is trying to destroy me and my fellow members, this is what this is about. This weekend, there's going to be a legislative ARP, you know, a breakfast. I'm going to be there and raise some more hell. Okay? Very simply put, this is what this is about, to fight. Okay, to write letters. And, you know, even if you are in a wheelchair, you have your fingers free. Call your legislators. Send that email. Talk to your neighbors, your family. I'm talking to, you know, first of all, the people in my family that I didn't know were in, you know, Medicare Advantage. So I don't, you know, apologize for my passion, for my anger. You know, it'll probably still go on when I, even under my grave, I'll be, go on, you know, kick ass, you know, whatever. Because this is what it's all about. Get out there and fight.
I have a question for you. What legislative breakfast were you referring to?
The ARP one, the one that's going to occur, and I will tell you in a minute.
Sure, thank you.
This is going to be, yeah, on the 21st, this Friday, 9:30 to 11.
It's in person or?
In person.
Okay.
In person.
If
and
you
they're going to be
send
sorry
some
that they invited me, you know.
If you,
Okay.
Okay,
You know?
if there's a way to connect with Matt or someone to send some information on that.
Oh gosh, I
Yeah,
don't, you know, I think you better just call ARP or
Okay, I'll contact them. No
yeah,
problem.
contact ARP.
Okay, thank you.
Okay. Anyway, again, the legislative breakfast, you know, they're going to have legislators there. I don't know which ones, they haven't told us, but it's going to be 9:30 to 11.
Okay. I also took note of it, and I will find the details and also send it to folks. I think Antonia and many other adults in New York City have been on this fight. I've attended sometimes as a young person. I fell sick after a rally. Marianne broke her shoulder and she just did a surgery 2 days ago because since November, her shoulder was frozen. She fell in front of a court fighting for older adults. Last year, early this year, I was in a protest. It was raining and I fell sick after the protest because a council member from Chelsea, we wanted to see if he would sign on, and I saw last week that he has signed on, and a council member in the lower district, District 6, has also signed on. And because of the pressure that everyone is putting, is leading to an effort. Is that same passion I want you all to take tonight? Matt, I've sent the info for Oko. Please call, test, call. I just want you all to call, and load their phones. Tell all your friends, younger people, older people, test 10 friends tonight with the info. Just call. Tell them to push the deadline because it might seem insignificant, but at the end of the day, it makes a difference when we all activate. I have seen that from all the older adults I've had the opportunity to work with, including Marianne, Bobbie, and so many other people that are in this fight. We appreciate all of you for continually pushing forward to make sure that New York does not only say is the best place to be, but it actually be the best place to live for everyone in all age of the life cycle. So thank you very much for the opportunity for joining us tonight. Our two speakers for sharing a lot of the information. Please, when you drop from this call, if there's one thing you can do, not for my campaign, for yourself, is to either call your council rep, call Oko office, make sure you let them know that you want the deadline to be pushed and you support Intro 1096 because we cannot wait for our healthcare to be protected. What we're experiencing at the federal level, we're experiencing it at the state level too. At the state level and at the city level. So we need government at all levels to work for us. So thank you very much for the opportunity to have this conversation with you guys. Matt and I, we are available. Our emails are available. We're going to gather all the information, direct you to Bobbie's website, direct you to Marianne's website as much as possible. Thank you all for joining us tonight. We really appreciate it.